And now we're excited to be joined by Dr. Nuria Sanchez Clemente, who is a clinical academic specializing in emergent congenital infections, neglected tropical diseases, and migrant health. Um, she's been focusing on vaccination uptake, infectious diseases, and outcomes in migrant children using nationwide data sets, and also collaborates on the life Zika self-study, long-term impacts of congenital Zika infection in Brazil. And today, from that, we're hearing about amplifying voices, the power of public and patient involvement in research, which is obviously an important part of all the research that we undertake. And from all of the projects which we undertake at Reach, we hope to have a PPI component too, and we're expanding our PPI projects and how we deliver that. So it'd be really exciting and important to hear from Dr. Nuria.
Thank you so much, Conan and Sarah, for having me today. Thank you for the lovely introduction as well. As you said, can you hear? Is their connection okay with everyone?
Yeah, all good.
Okay, brilliant. So thank you, Conan, for the introduction. As you said, I'm a senior lecturer and a consultant in paediatric infectious diseases, and I'm currently working at St George's in Evelina. I'm going to talk to you today about one of the aspects that I enjoy most really about research. Yeah, as you'll see, there'll be examples from different areas that I'm interested in. And currently those are, as you mentioned, around congenital infections and migrant health. And please feel free to ask any questions. Let me just... Okay, brilliant. What is patient and public engagement and involvement, and why is it important? So it can be defined in a number of ways. This is a definition from Oxford University, but essentially it can be a completely varying activities that engage members of the public or our patients in the conduct and dissemination of the research. And the idea is that this will have a mutual benefit, that this will actually be bring something to the research, both for the participants and for the researchers, as well as policymakers. It obviously is crucially important. We obviously, particularly individuals potentially that are not clinicians, that it's really important to know what we're researching, and that these the questions that we're asking are relevant and important to answer for those patient groups that are involved. They're also really important to set up future communication channels. So obviously we want to be able to discuss the research findings with the communities that we serve. And this is, engaging them early on in the process. It means we will know the ways that that communication preferences, and also they'll be able to disseminate research findings within their own communities. As I said, I think for me, it's one of the aspects that I enjoy the most. I think it makes research really interesting. It adds a completely a more tangible layer to what we're doing, and it gives you the opportunity to engage different parts of your brain. As you'll see, a lot of the examples, I really enjoy art and all artistic forms, and so it's a really great way for me to sort of engage with individuals that are doing something completely different to me, and engage with artists and things like that. And it's just a point to make that it's not the same as social science or qualitative research. I think often when you get down to sort of writing grants and thinking about this, sometimes it can kind of end up being put in the same section. I think it's just important to remember that it isn't research really. It can obviously be really crucial to establish connections with people. If you're then going to do a piece of qualitative research, it might be a really good starting point, but it's just to be mindful not to include it in the same section, for example, when you're going to submit for a bit of funding for it. I'm going to start to talk a little bit about different levels of engagement and participation, and hopefully the examples I'll give you address you know, some of these, this ladder of participation, this is a ladder that you might have come across before. It was sort of coined in the sort of 60s by Sherry Einstein, who was like a social scientist and working with the Department of Health in the US. But it's been sort of adapted here to sort of think about a bit more relevant to us in sort of research and medical research. And it's just looking at sort of, you know, at the bottom there, for example, you might think about, you know, the lowest levels and the sort of what we're not really engaging at that in that purple areas. Obviously, you know, if we're trying to convince people to be part of a vaccine trial, for example, and we're coercing, we're trying to you know, get them to do something for us, and then you're moving up through the layers to sort of educating and then informing and consulting, and then when you're getting kind of to the top, you're actually trying to do something that's much more you know, much more doing something together. So producing something together, co-designing something together. And we'll talk a bit about, you know, how, you know, you would go about those kind of different ways of engagement and participation. And you'll see here that, so some of the resources, I sort of wanted to also signpost to some of the to resources that you can then go to afterwards if you're going to embark on a project. So this IRIS is an organisation that's based in Scotland that does lots of public engagement more with social work, but I think it's got some really, really good tools that I'll talk about in a minute as well. So when we think about public engagement, first of all, this is Involve is one of the leading public engagement charities in the UK, and I think they also have some great resources. There'll be links here. Hopefully you'll be able to get the slides later. But it just kind of breaks it down into the different sort of key components of good public engagement. And I think I've talked a little bit about some of these already, but essentially the first is obviously that it should be something very meaningful. It shouldn't be an afterthought. It should be something that makes real difference to the individuals involved, to the researchers, and hopefully to policy as well. It should be very, very transparent from the start. You know who you are. It should be a reputable organization doing the work, and you have to be very clear about what this is and what this isn't, what you're able to achieve with this and what you're not. And you know, integrity is obviously a very big part of this as well. Being very open about what the whole process is. I think you'll see with the examples that it's very, very tailored. You know, even though you might be able to call on resources to help you, every single type of engagement is very tailored to that particular community and what kind of level of engagement you're doing. And so in the same way, this is going to need to involve the right kind of people and the right number of people. So for example, if you're going to do a project that's within the scope of pediatrics, you might want to make sure that there are, you know, individuals within your group that are parents or that are grandparents or that have some lived experience of having children. You know, it might be that they care for other children or that they have close family members, and that you know to capture those kind of those voices that are harder to reach if possible. Obviously, you know, respect treating individuals that are coming to you and making them feel comfortable in a good space to be able to do it. This is a really important point that you know, it prioritizes the participants' conversations and discussions. Often we can end up sort of taking over a little bit as researchers and wanting to give lots of information, and then it ends up being that actually, you know, when you look back, it was actually more the researchers disseminating information, and it should really go back to the participants' discussions. And you know, there are examples of activities where I've been involved that, you know, even sort of some of the facilitators that you get involved to help you, you know, they end up really taking over, and you have to sort of think, oh, okay, you know, that's something to think about for next time. And then reviewing and evaluating your technique and your process. I think this may come a little bit later, but I think it's really important to try to get some feedback about these activities to then try to improve practice. And key as well is obviously to keep the individuals informed about what you're trying to do, and then feedback afterwards, what you've gained from the experience and what your next steps are. And then just to talk to you about co-production, and just, I'm going to mention a couple of examples of this, but this is sort of taking things to a kind of different level. So it's actually involving individuals in service design, in the design of a research study from the very earliest stages. So you're actually kind of really blurring the lines between researcher and public or patient. I'll give you some examples, and then hopefully some tools that you can then go away and maybe read up about this, because this is actually it requires quite a lot of specific methodology and training. It's obviously it's trying to kind of establish that kind of as the last point here says, it's that we actually become facilitators rather than sort of the providers, and so the whole process almost takes place without us being too involved, and so it's a completely different concept, and I think it requires specific training, and it's amazing when this is done well. So I'm going to take you through some examples that kind of illustrate the different approaches to PPIE, and I think all are really have their place, and I think as you'll see in a minute, PPIE does require usually some funding, and we don't always have good funding for this. So I think it's just worth bearing in mind that there are lots of different levels. And so you might do something that's just like a very one-off event. So at our university, often we get involved with things like a pint of science, which is kind of talking to people about our research in a kind of in a pub, and getting feedback from audiences around that. And there might be other kind of community events or events in a museum. And so these are kind of interesting ways that are a sort of a short snippet of something that you might get something out of. And then you might think about, well, maybe you get some short-term funding for a specific project. And again, this is something that it might be just a very pinpoint point in time, and you can get some really good work around that. But it's something that maybe you can't carry on forward, or you end up going in a different direction. And then when it gets to more like trying to do something a bit more longer term and meaningful, is thinking about creating a longer term sort of PPIE group, and actually working with a group for years, really over years, to try to develop research ideas, and as I said, dissemination and even code design and co-production. And as part of this, sometimes what you can do is create a kind of advisory board as part of that, who then have a specific role within that can give you you can we'll talk about sort of remuneration and things, but it's thinking about specific things that you might need to do to make sure that you're meeting the PPIE kind of criteria that you've set yourself to do. So this is just to make you aware that obviously payment is a part of PPIE, and we need to be aware that all different activities require a payment within it. So in the UK anyway, the NIHR, for example, sets out very clear guidance to how we remunerate individuals that are doing PPIE activities. So you can always refer back to this and use this if you're applying for funding and things like that. So just a mention of that. And it's important to also bear in mind that when we talk about involving the right kinds of people, and is that obviously for example, if you want to have parents of young children in your research in your PPIE group, you know, you're going to have to also pay for things like childcare maybe and transport. So all of that forms part of it, and you need to just make sure that that's all included. And often the way we do this is with vouchers. And as I said, funding is really important. And where can you apply for funding? So most universities do have small pots of cash, sort of £1,000 or £5,000. So it's really worth trying to apply for these. I think they actually are not that difficult to get, especially if you've got other people that have gone before you, you can kind of look at their applications and just use some ideas. Hospital charities as well, they're really, really keen on these kind of projects, so you can look to them. And then obviously some societies, so maybe RCPTH or other societies might have some funding. And then if you're applying for sort of funding for a PhD or for a pre-PhD or post-PhD, you know, often there will be some funding that you can allocate to PPIE as part of that. So there are little pots of money there around that you can get hold of. And so I'm just going to start by talking about a few different kind of top tips kind of things, and then I'll go through some specific examples of these. So in terms of creating a longer term PPI group, I think really key is to try and, if you can, join forces with other researchers that are interested in your area, and just basically raid your contact book of anyone that you've worked with before, or local communities and charities and NGOs that work with that specific interest group or condition that you're interested in, and just absolutely just send you're going to need to send out a lot of emails, and you might not hear back, but it's a lengthy process, but it's around capturing that diversity and thinking about what kind of groups are really, really important. So within migrant health, for example, you want to try and capture groups of migrants from lots of different ethnicities and backgrounds, and different genders, and so it's just thinking about, have you captured that kind of diversity? And what's been really good and a great experience for me is working with sort of experts by experience who have done PPIE work before. They often have great contacts and have already worked with lots of NGOs and other individuals, and they can really help you to actually co-lead some of these sessions. Oh, hang on a second. Just make sure I don't have to restart my computer. And then thinking about, what other skills can you maybe bring with you to the group. So you'll see some examples of artists and, or people that are into filming, or people that speak different languages that might, be experts by experience that they then can translate. So it's just thinking about that skill mix as well when you're creating a group, both on the facilitator side and the individuals involved. So yeah, I've spoken a little bit about this already, and also just going to keep an eye on the time, and thinking about, obviously you'll need to plan many things. So thinking about all your vouchers, as I said, and the food that you're going to provide, and making sure that that's all appropriate, and then thinking about how you're going to start off these activities. Often it's great to try and have something a bit more active and icebreaker type things to start with. And then before you actually talk about, the research ideas and all the kind of more serious things. And then this is, you'll see some artwork by this amazing artist, Ada, who's down here at the bottom in one of our sessions, but it's thinking around how can you sort of use other media to document these activities, to then also be able to disseminate, like a summary of the activities of the day in a very visual way, which is much nicer for the group, rather than having to sort of, look at sort of meeting notes or slides and things like that. And I've left here lots of links to sort of materials that can help you to plan. This is, again, this Iris charity that has all these kind of amazing resources that you can print out. They've got icebreaker ideas. They've got these lists of things to not forget when you're planning a session. And definitely recommend you have a look. It's a great resource, and there are more out there, but this is just one example. So I'm just going to run through quickly some projects that I've been involved with, just to try and illustrate a few of the key concepts that I talked about. So this is a project, this is the first project I was ever involved with in with PPIE. This was during the pandemic, and as I said, I was working with in Zika research in Brazil, and had come back, and obviously things were kind of very much at a standstill with travel and things. And we got a little bit of funding to essentially talk to women about the experiences of COVID during sort of pregnancy and in early motherhood, particularly talking to them about their experiences of it at the time. The vaccine wasn't sort of hadn't been yet disseminated to pregnant women, and we talked to them about how their feelings around this, and it was just great to sort of think about. There were lots of parallels with the Zika epidemic in a way of, how do you feel as a mother during, being researched? We were able to sort of think about how we would then maybe use that for future Zika projects of, how do you want to be involved in research? What are your feelings around that kind of not knowing, how as a pregnant person, whether you can take the vaccine or not, and things like that. So it's a really interesting project that then was a little starting point for some other work for Zika later on. And what we did is we used that budget. Essentially, we did workshops online. And then we had an artist that basically drew portraits of the women and their children to then give to them as a kind of a gift for participating in the project. And that was an example of a very short-term, small budget, just small snippet study that was just opportunistic. This was then the second project I was involved with. It was later on in the near during the kind of COVID times. And you may have seen some things around sort of the decolonizing global health movement. And I was a postdoc research fellow at the London School. And there were lots of conversations around how we can improve things, and how we can sort of start a conversation around, the new ways of working, essentially in the kind of decolonizing global health movement. And so we got a little bit of money to try to start this conversation, and we worked with this amazing artist, Louise Gunn, who's in here in the photo, and we essentially thought that, we had lots of discussions with her as a also part of our group around sort of thinking about sort of, those individuals that are not celebrated, that are forgotten almost in the research process. And so what we did is we sort of discussed with several individuals that we felt belonged to groups that were sometimes forgotten. So we spoke to sort of cleaners in the London School of Hygiene and Tropical Medicine. We spoke to, field workers within our Zika group. We spoke to sort of alumni of the school. And essentially we held several workshops and tried to get some of the key messages around, what can be gained by sort of trying to make sure that we, remember those individuals that are sometimes forgotten about. And so these workshops then led to sort of some sort of discussion points, and then messaging and words. And then what we ended up doing is that she kind of drew these portraits of these forgotten individuals, and combined them with these words. And we thought of this idea of projecting the messages on the facade of the school. And so we linked up with the Bloomsbury Festival, which happens once a year. and they were really keen on the idea, and they actually helped us a lot with the costs in projecting this, and we projected it over an evening in October 2021, and essentially had conversations with the public. So this is just some photos of the actual evening where we discussed with the public who were sort of there for the Bloomsbury Festival around on the street, and we'd invited lots of people from the nearby universities just to have a discussion around decolonizing and what would be what were their feelings around the ways forward, and we kind of continued this on our website. So that's another example of a kind of a shorter term using kind of art and engaging the public in conversations. Sorry, I'm really aware of time, but I'll try to rush through this as much as possible. This is an example of creating a kind of a longer term PPIE group. So in 2023, together with the Migrant Health Research Group at St George's, you can see us in some of these photos, but essentially the Migrant Health Research Group is led by Sally Hargreaves at St George's, but there's a bunch of us working on migrant health research. There's GPs, there are social scientists, and lots of multidisciplinary researchers, and it's a great group. And I think we've all wanted to sort of set something up, together to try to establish kind of these longer term links. And so these are just some pictures of our first ever session with the Migrant Health Community Research Network, where we kind of basically did just some very basic getting to know each other. We got together, I think it was 40 individuals with lived experience of migration, of a very diverse group. And we just talked about, the initial phases of, communication and what they wanted, what their research interests were, and what everyone's aims were, of this group. And this was, as I said, the first session was in 2023. And since then, we've had several meetings. Mainly, we try to do these in person, but we do have some online as well. And so this is another, you can see, sorry, but just going back, that this is some of the Ada again, who was in this kind of visual, abstract, amazing artist that kind of worked with us, has worked with us in all these events. And so here you can see this is one of the pieces she created around this is sort of, we started this off on just paper and pen, but we would talked about the sort of the barriers here at the top, and then some of the solutions that we sort of co-created with the group at the bottom. So that's been just a really fascinating journey with them. And this is another event we've done recently with some of the GPs in the group, co-designing a health catch-up tool in primary care. Again, this is one we did that we actually used our own language expertise in the group to host this event in sort of 4 different languages, which was really a great success, and everyone very much enjoyed that one. And this is I won't be able to go into this at all, but this is another one of our researchers in the group, Alison Crawshaw, who did her PhD, which was completely co-produced, and it was with the Congolese community in Hackney, who she had some connections with, and she essentially co-designed this intervention to strengthen COVID vaccination in this group. And she used, they sort of did a lot of theatre and dance and lots of different techniques, having really worked really hard to sort of actually train in these co-production methodologies. So a really good piece of work if you want to really deep dive into the methodology behind co-production and doing it really, really properly. Her whole PhD was co-produced, and it's amazing work. And then this is just an example, thinking about sort of, this is a bit later on, sort of disseminating research. Again, this is going back to the Zika work, and it's sort of the start of a study, which is going to be an 8-year-long study, following up the children affected by Zika, having worked with them for 6-7 years already. And so what we were trying to do here is to sort of disseminate some of our initial research findings and then discuss, what are the priorities now that the children are this age, and we sort of wanted them to, we'd listen to them and talk to them, and they wanted to have these events to also meet and see each other, because it's really hard, obviously, to get around when especially in place in kind of remote areas of Brazil, it's hard to get around. And so actually having an event where all the different families could get together and the mums and have some respite, and at the same time as talking to us, they felt was really a good opportunity. And this is just a little photo of one of our researchers actually was in this like TV show with all these like little funny characters. And so it's just thinking about, if you're going to do an event with children, how you can entertain the kids as well, so that you can speak to the parents. And then I think this is my last example, but this is something that so this is the UK Chagas Hub, who do Chagas screening events all over London and probably even further out than London. And this was an event that was hosted in Hackney by local councillor, talking about housing and trying to get on the housing market for Latin American communities in Hackney. And so what the UK Chagas Hub do is that they will come to events like this and then do point of care testing for Chagas, and then they'll get the results immediately on the day. And I think this is just to mention that you can actually be, with contacts and knowing that these events take place, you can be really opportunistic, and the engagement is incredible. I think that day we tested sort of 40 people, and we actually run out of tests. And you can really, people are really actually quite willing to engage and have conversations around their health in these quite public areas. And I think there are obviously downsides of, like not being able to have a private space to have a conversation maybe, but some things are, doable in these kind of scenarios. And it's just, it's around sort of being a bit inventive and thinking about where you can kind of engage with your communities. So this is just a kind of summary. So I think essentially, I think you really need to think about PPIE really early to make it meaningful, making sure that it's not tokenistic, that it's not just kind of at the end of something. It's thinking about it right at the start, and how can you involve people right at the beginning, and do it well. So the payment aspect, making sure that you've got an appropriate space, that it's comfortable, and that people enjoy coming, and then maintaining those relationships really long term, because I think they're really key, and they might bring more and more interesting work, and really important to always feedback what the findings are, and keep that constant communication with the communities. So I just want to thank you again for having me. Sorry if I think I've overrun a bit. And thank you to the St. George's Migrant Health Research Group, who are fantastic, and the team at the London School of Hygiene and Tropical Medicine, the Zika families, and all the PPIE participants that have been involved. Thank you. And let me know if you've got any questions.
I do have one question for you. So as part of our readiness study, we're planning to gather some data on parental experiences related to the studied topic.
Mm-hmm.
You were alluding at the beginning of your talk to the difference between qualitative research and PPIE. And I just wanted to explore that a little bit. Like, it seems quite a soft boundary sometimes, whether you're an opinion on a research topic or how research should be done versus any other data collection from members of the public.
Yeah, I think that's a really good point. And I think there's also, I think one thing that's important to note is around ethics as well, because obviously, if you're interviewing families as part of a qualitative study, there will be consent and there will be, ethics involved. And I think PPIE is different. So, you might get consent to maybe, take some photos and things like that, or be involved in some materials, but it's not the same as being involved in a research study. having said that, you know, there are, you know, areas where you may start to have a conversation with someone and then think, well, actually, this would make an amazing, you know, in-depth interview, or, you know, focus group, you know, or something that you could actually turn into research. And I think, you know, it's just knowing where that boundary lies and what, you know, what you're planning to do with it afterwards. And if you're planning to publish it, then I think, you know, you know, you can't really publish people's conversations, you know, unless it's part of a research project. I think you can publish an experience of PPIE, keeping things, you know, talking about some methodologies around, you know, how you created a PPI group, or maybe even the evaluation process. So I think some of the members of our group are now evaluating. So we're evaluating ourselves. You can get external people to evaluate you, or you can just self-evaluate, self-appraise, and then maybe publish that to say but I think, yeah, you wouldn't really, you know, you haven't really got consent to publish conversations that you're having.
We do summarize and write about our PPIE findings, don't we? And, you know, and they're put out.
Yeah.
They're just summarized in a beautiful artwork or feed into project design. They do go into documents,
Yeah.
and we gather data and this from members of the public, but yet doesn't go through ethics. It's quite, it's a
Yeah, it is.
fine
It
line.
is a fine line. You're right. Yeah. So, but yeah, happy to discuss any ideas with the Billiness study in future.
Get in touch. Thank
Yeah.
you.
No worries.
Again, thank you so much, everyone. Thank you, Dr. Nuria, for sharing all of your experience and wisdom and knowledge. We're very grateful for it. And thank you, everyone, for joining us and giving us your time this evening.